Do you agree that medicine is broken as it is right now, practiced?
Medicine has been broken since the beginning of the American Medical Association.
Right. So it's been a long time.
It's a medical mafia. It's a belief system. It's not designed to get people better. If you study the history of it, you'll find that it's really a drug sales vehicle. It's not designed to get to the etiology. It never was. It's a business model, point blank. I was listening to a podcast several years ago, or a recording, and a doctor confided on the podcast. He was the head of a hospital in LA. And he said, whenever business starts to slow down, we get together in this hospital and we try to figure out ways to get more people into the hospital. And one of the tricks that's used is diagnostic imaging. And if you look at the research on diagnostic imaging, for example, they've done large sample studies where they've MRI'd the low backs of hundreds of people and then taken their MRIs and put them before a panel of surgeons. But what they didn't tell the surgeons is that none of these people have a history of back pain. What they found is 50% of these people on MRI had what surgeons considered to be cases that needed to be operated on immediately, such as bulging discs, sequestered discs, but none of these people had any pain. So what the truth is that you cannot correlate a diagnostic image to a functional disorder, because the human body has tremendous capacity to adapt. So the point is, the medical system is designed to scare people into spending money in getting treatments. And if you research cancer and all this other stuff, you see that this is really kind of like tricking people into fearing their life and fearing that they're going to have these problems. And so that kind of behavior is repulsive to me. It's absolutely repulsive. And it's exactly the kind of behavior that led to COVID, that's led to all sorts of political scandals. And unfortunately, it's just the dark side of the human being. It's not just medicine. You see it everywhere you go.
I would agree with that. And I would say it's really unfortunate when it comes to medicine, because that's the art and practice and science of healing, right? And without that medicine, people may die. People may become very unhappy with their life, very unhealthy, and not live a fulfilling life. And that's where it gets really, really kind of into this borderline. Is this ethical or not? You could go into those conversations because some people may not see it. But one of the things I know you mentioned is during your time, I believe, at that center, you were known as the last resort, and your story kind of illustrates that. At our clinic, people sometimes joke, and the medical staff jokes, that we're not the New York Center for Innovative Medicine. We're Last Chance New York. You come here as your last chance to save somebody's life after they've gone through the conventional route, everything else. Why is it that even when you show results, you showed results, everyone agreed with it, why is it still that we are turning to holistic health practices as the last resort and not the first?
Because one, they work. So if the medical model actually tells the truth about holistic practices, then they will lose a huge amount of money that's being spent on drugs and surgery and routine doctors' visits based out as fear. If you look at the statistics on things like mammograms, it's ridiculous how they're not even useful. I think only about 4% of mammograms actually ever turn out to be useful to a physician. If you look at Dr. Vert Mooney's book on low back pain, he said only 1 in 1,300 x-rays taken ever changes the course of treatment, but the average cost of an x-ray at that time was $75. So you see what they've got is a system of making money by scaring people, and they don't understand functional movement or functional anatomy or integrated health practices or the impact of diet and lifestyle. In fact, I don't know if you remember when C. Everett Koop was the Surgeon General of the United States. Well, he came on television, and I don't watch much television, but by the serendipity of it all, I happened to just see his address one day. And he stated 8 of the top 10 killers of Americans are lifestyle diseases. And if people would just eat better food and get more exercise, they would be far less likely to suffer these problems. They fired him the next day for saying that.
It's a lot of money lost when he said that, right? If people are listening,
of course,
right? That's
right.
Trillions these days, I would say, that you're losing because of that statement.
So the point is the medical system has worked very hard to turn holistic health practitioners and allied health practitioners into witches, into woo-woo medicine, snake oil. In fact, I knew I was becoming successful in 2008 when I was listed on the Quack Watch, which is a group of doctors that identifies quacks. And I couldn't help but crack up laughing because if you go to their website and see who they have on, some of the best doctors and therapists in the world. So what they do is they actually pay people to do this, to go out and find successful doctors and therapists and deface them. And then the medical system, if they're too good, will go after them. And I could give you a long list of documented cases of skilled doctors doing things like your father that got put out of business or disappeared off the face of the planet because they came up with cures for cancer.
Yeah, no, I mean, there was a time where I felt that integrative oncologists in Florida were kind of dropping like flies, and people were worried for people like my father and others who weren't even oncologists, let's say, but just trying to help people through different ways, some being with cancer and others and getting great results. But yeah, I mean, there's a lot going on of this negativity. And you know, you run the Chek Institute and Academy. You've been doing this for a while, helping a lot of people. Do you see the tide changing at all, that people are demanding difference, you know, a different style, a different approach to medicine?
For sure.
Is there a change, or do you see this just staying the same with these Goliath pharma companies running things and people just getting sicker and sicker, really?
Well, I'm going to answer this in a couple of ways for you. I tell my students there's no such thing as a bad drug or a bad exercise or even a bad surgical procedure. There's only an incorrectly prescribed drug, exercise, or surgical procedure. So I've never had anything against the concept of medicine itself, but I always remind people the Hippocratic Oath is first do no harm. So any doctor that's really, and in the word doctor in Latin means teacher. So doctors are actually authentically supposed to be teaching how to people be healthy. And in China, for thousands of years, the doctor did not get paid if you got sick. He only got paid a regular monthly stipend when your family was healthy. That's real medicine. So what I've found is over the years, because so many movie stars and elite athletes have come up against the kind of the end of their line with the standard medical system and ended up in the hands of Rolfers and Feldenkrais practitioners and acupuncturists and craniosacral therapists and a long list of others, nutritionists, holistic nutritionists, and gotten great results. That there's now so much information out there that anybody that really wants to try something different can find it in, 0.28 seconds on Google. And so what I found is there's really two kinds of people in the world. The kind of people that are really motivated to engage themselves and take control of their own situation and will do whatever they need to do to get healthy. And the kinds of people that still are in the child archetype, just want to be told what to do and don't want to participate and would rather just take a drug or have someone cut it out.